As promised, this is the beginning of the overview of the medical billing industry to enable you to understand what it is that medical billing companies do, and thereafter to understand exactly what a joint venture will mean to you and what it will allow you to do in marketing to medical providers. One of the nice things about medical billing is that every doctor has to bill someone to get paid.
With all of the schooling, training, and hard work the doctor does, at the end of the day, in order for him to get paid, he has to bill some insurance carrier or some governmental agency.
There are very few doctors that have risen to a level of their medical profession to be able to only accept private pay. I would guess that that's maybe 1% of the doctors, and they are able to be very picky about their patients. They do not accept any insurance, and they get paid in full by their patients. The good news is that it's only 1% of doctors, and those doctors do not need any special medical billing. So we're only concerned with the other 99% of doctors who do have to bill a third party. Doctors make a choice to either do their billing in-house or they use medical billing companies. In fact, there are two different approaches that a medical billing company can take depending on whether the doctor uses his own staff for medical billing or if he currently outsources or uses a medical billing company. For all intents and purposes, every doctor needs what you are selling, and that is probably one of the greatest positive aspects of being in the medical billing business. In fact, as a medical billing company, you have very little geographic limitation. You can sell medical billing services to a doctor around the corner, in the city in which your office is located, in the state in which your office is located, and in virtually every other state in the country. In fact, very few states, New Jersey being one that comes to mind, requires a medical billing company to be licensed. And while before entering a particular state, it would be wise to find out if there are any rules regarding having a resident office in the state or licensing, typically you can go to any state you want, and in that sense, the world is your oyster because every doctor needs what you're selling, and the geographic range is huge.